So by this time, you guys should have had some exposure to scanning. All right, so again, most protocols when you're scanning starts with the parasternal long axis view. And the parasternal long axis view is obtained by putting the transducer in the third or fourth left intercostal space with the marker towards the right shoulder. And this is the view you're supposed to get. Okay, so this is the septum, the interventricular septum. This is the LV cavity right there. This is the posterior wall. Okay, mitral valve. This is the anterior mitral leaflet. The posterior mitral leaflet is right there. This is the left atrium. Your aortic valve opens and closes. It opens in systole, closing diastole. Your aortic root is right there, and the ascending aorta. And this is the right ventricular flow tract. So let's put it in motion, and then you can see everything as it is. Okay. All right. So the anterior mitral leaflet on top, posterior leaflet right there. Okay. And again, you always have your ECG someplace. Okay. So this is your parasternal long axis view. So the aortic valve closing diastole, opens in systole. Okay. So you need to, in your mind's eye, you need to know exactly what your image supposed to look like, because that is what you're trying to achieve. This is the descending aorta right there. Okay. So that's your parasternal long axis view. You need to know how to get that view. So you always start with the parasternal long. Your RV inflow view is obtained from the parasternal long axis view and also your short axis view. So these are some sets of M mode. So we're not doing M mode today. So we're going to skip them. Okay. We're going to skip all the M mode views for the time being. All right. So this is again your parasternal long axis, but we're using color flow Doppler. Okay, we have not done color flow Doppler with you guys yet, so all we're looking at is just the two-dimensional images. So the septum, posterior wall, your left atrium is right there, mitral valve, anterior mitral leaflet, posterior leaflet, and your aortic valve. Okay. So we'll do Doppler comes after we start doing systolic and diastolic systolic function really. So again, interventricular septum, and this is your posterior wall, LV cavities there, anterior mitral leaflet, posterior mitral leaflet, your descending aorta. Okay, so parasternal long axis view, you're supposed to see the valves opening and closing. Okay, this is your aortic valve which opens in systole, and the mitral valve close in systole. Okay, again, your ECG is on the bottom. Your images are gated. That is, it's either systolic frame or a diastolic frame. So remember that everything that we do in the heart is either in systole or diastole. All right, so remember now we talk about the measurements. So in diastole, you're going to measure the septum. So you need to get to right at the tip of the mitral leaflet. Okay, Um, okay. Now we talk about the plane of the LV. The plane of the left ventricle is like this because the left ventricle is going up. So the plane of the LV is like this. So when you're doing your measurements, this line should be perpendicular to the plane of the LV. So this is how it's supposed to come. Okay. Okay. So this line from the septum to the posterior wall supposed to be perpendicular to the plane of the left ventricle. So this is not how it's done. Okay, perpendicular. Okay, and you measure the LV cavity size in diastole, you measure the posterior wall in diastole, and you measure the septum thickness also in diastole. Your measurements, your QRS is on the bottom, your ECG is on the bottom. You want to do your measurements at the onset of the QRS. So you're going to put your marker at the onset of the QRS, and that corresponds to diastole. In diastole, the mitral valve is open. You can see the mitral valve is open, the aortic valve is closed. Okay? You measure the thickness of the septum, LV cavity size in diastole, posterior wall. You also supposed to measure the aortic root. So the aortic root is also measured in diastole. Okay, the aortic root. So these are the diastolic measurements. Okay, and especially when you're doing exams, they expect you to know it. They commonly ask these questions because if you don't know it, then it's a problem. Because you can't be scanning, you can't be saying you're a technician, you're scanning and you don't know how to measure, what frame to do your measurements. And so, all right, so, okay, so again, parasternal long axis view. The transducer is in the third or fourth left intercostal space. The mark is towards the patient's right shoulder, and this is the image you're supposed to get. All right, so the posterior wall, anterior mitral leaflet, posterior leaflet. You can see the cords which attach to the anterior and the posterior leaflet. These are the coordinate tendonae, the ventricular septum. This is your aortic valve, which is open. So while you're doing it, the heart will be moving and you have to know what to do. Okay. So you don't do in with your systolic frame, you don't do the aortic root, you do your left atrium, and you also do the LV cavity size. Okay, again, it has to be perpendicular to the plane of the LV. So, okay, so you measure from the septum to the posterior wall. Okay, you measure the distance. Okay, the distance from the septum to the posterior wall. That's the LV cavity size in in systole. You have They commonly test you on these things because these are basic things that all technicians supposed to know. So you're going to be tested on that. If you don't know that, then you shouldn't be scanning. All right. So again, you'll be tested on that. All right. Alright, so you measure the left atrium and the LV cavity size in systole. Okay. Again, you can zoom, know where these features are located on the machine, so you can zoom, you can enlarge things. So if you want to look at the aortic valve opening and closing, um, you want to have a closer look, you can zoom it and have a look. Okay. Okay. We measure this is the LVOT diameter, the left ventricular outflow tract diameter. Okay, you measure it a few millimeters in front of the aortic valve. That's from the tissue blood plane to the tissue blood plane. And this is how it's done. This is a systolic measurement. Again, you need to know what you're going to measure in systole, what you're going to measure in diastole. It's very important. So this is systolic measurement. All right. So these are color flow Doppler, and we're looking for regurgitation or abnormal flow. All right. So again, when you're measuring the LV cavity size, this measurement, this line should be perpendicular to the plane of the LV. Again, the plane of the LV is not straight down, okay? The plane of the LV is like this. It follows the LV cavity, so it's like that. So if the plane is going to be perpendicular, it has to be 90 degrees. So it has to come down like that. Okay? So this is not the correct way to do it. And your measurement should be at the tip of the mitral leaflet. Okay? All right. So again, these are things that they test you in the exam, because if you don't know the basic stuff, that means your scanning is incorrect. Okay. So this is your RV inflow view. And to get the RV inflow view, you just position the head of the transducer towards the patient left axilla. Okay, that is towards the armpit, and you'll get your RV inflow view. So with the RV inflow view, the top is the right ventricle. This is the right atrium. Okay, and your tricuspid valve is right there. Posterior leaflet, the anterior leaflet. Okay, so this is the eustachian valve. Just above that, you get your coronary sinus, and then right here is your inferior vena cava. Okay, so this is the right atrium, the mitral valve here, and the RV, right ventricle. That's one of the better view to evaluate for tricuspid regurgitation. Okay. Okay, so you put your color We don't do that, but you're looking for tricuspid regurgitation. It's one of the better views to look for that. Alright, so that's Doppler. We're not doing Doppler, so we're gonna skip those. So what you need to do is practice these scanning views, and that's the only way you're gonna get proficiency at it, is by practicing. Okay, so those are Dopplers again. Alright, so we're gonna move on. So we showed you how to do your diastolic measurements and your systolic measurements. So this is short axis at the level of the aorta. Okay, short axis at the level of the aorta. Okay, so your aorta is right here. The aortic valves is right inside here. Okay, so you can see when the aortic valve closed, this is a closed aortic valve. It has this Mercedes-Benz configuration. So this is the aorta with the aortic valve inside. Your tricuspid valve is right here. This is the right ventricle. Right ventricular flow tract is right there. Sorry, right ventricular inflow tract is right there. Right ventricular outflow tract is right over here. Okay. Tricuspid valve. Your pulmonic valve is right there. Okay. So this is the right ventricle, tricuspid valve. This is your right atrium. This is the right atrium. This is your atrial septum. Your atrial septum. This is the left atrium. If you remember what we told you in the anatomy session, your atrial septum is adjacent, or your non-coronary cusp is adjacent to the uh, atrial septum. Okay, because they're going to ask you to identify stuff in the exam, and if they ask you what cusp or valve this is, it's a non-coronary because it's adjacent to the atrial septum. Then this is the right coronary cusp, and this is the left. All right, all right, the pulmonic valve is over here. The pulmonic valve leads to the pulmonary trunk, which divides to give you a left and a right uh, main pulmonary artery. So to get the short axis at the level of the aorta, remember you're going to turn the probe from the parasternal long axis view. You're going to turn the probe to about the 1 or 2 o'clock position, and you're going to bring the angle of the transducer downwards. And this is short axis at the level of the aorta. Okay. Okay. So when you open the aortic valve, remember when the aortic valve opens, it opens in a triangular fashion. When it closes, however, let's pull it back a little. See, when it opens into a triangular configuration. Okay. See, triangle. When it closes in a Mercedes-Benz configuration. So you can see that. So you can zoom things up if you want a closer look. It opens triangular, close with a Mercedes-Benz configuration. You have to know how to move your probe to get that view. Alright, so we're going to skip the Doppler. So this is, if you want to zoom in on the pulmonary trunk, then you can zoom in on it. If you want to look at the pulmonary artery opening and closing, so you just zoom. So don't be scared to zoom. If you need a closer look at something, then you're going to zoom. Okay. And you can put your color Doppler in, look to see if there's any abnormal flow. So there are dedicated views that you can do to have a close look at the pulmonary valve and the pulmonary trunk and the bifurcations. Okay, so so there's a problem with this cusp. I don't know if you guys can see, but we're not teaching any pathology today. But this is our interatrial septum. Adjacent to that is your non-coronary cusp. So there's an issue right there. We're not going into that. This patient actually have a ventricular septal defect, but we're not teaching you guys any pathology today. So to move from your parasternal short axis at the level of the aorta, and you're going to go to the base, you just move the angle of the transducer upwards. So you're going to move the angle of the transducer a little bit upwards. And at the base, you're supposed to say the mitral valve. Okay? So from your aortic position, you're going to move the angle of the transducer up a little bit. And the base, that's where you have the mitral valve. Okay? So this is short axis at the base. This is our anterior wall up top. The inferior wall is down the bottom. This is your septum, and the lateral wall is over here. This is the right ventricle right up there. Okay? And the mitral valve is right inside here. The anterior leaflet is on top, posterior leaflet is on the bottom. So short axis at the base. And of course, as we said, we'll put color in everything. But so from the base, you're going to move the angle of the transducer up a little bit more, and you should get the papillary muscles. So this is one papillary muscle over here, another one there. This is the anterior lateral papillary muscle over here, your posterior medial papillary muscle. This is your anterior wall again, septum, lateral wall, inferior wall. Okay, so short axis at the mid cavity level, okay, where you have your papillary muscles. Then you move the angle of the transducer even further upward towards the apex. This is color. We'll put color in it first. To get the apex, you just move the angle of the transducer upwards a little bit more, and you get the apex. So this is the apex. The anterior wall is on top, inferior wall is on the bottom, septum, and the lateral wall is over there. Apex. All right, so we move down to our apical views. If you remember, to get your apical four-chamber, your transducer is going to be positioned at the intersection between your mid-clavicular line and the fourth or fifth intercostal space. And your heart should be standing straight up like this. Your ventricular septum, this is the apex, the lateral wall, LV cavity is right there, mitral valve, anterior leaflet is over here, posterior leaflet there. This is the left atrium right there, atrial septum, right atrium, tricuspid valve, and the right ventricle. Your marker is towards the 4 or 5 o'clock position. So again, the prober transducer is at the intersection between the mid-clavicular line and the apex of the heart, which is, about the fourth, fifth intercostal space. Okay, and this is the image you're supposed to get. Heart standing straight up. And we put color in everything. We're looking for abnormal flow. So okay. So this is we use our color flow Doppler because there's a ventricular septal defect right there, but we're not teaching that. To get the 5-chamber view, which this is a 5-chamber view, and as you can, your left ventricle is right there, mitral valve is there, left atrium, if you pull your transducer down a little bit, just pull it down, you know, just a tad bit down, you open up the aortic valve, and that's why we call it a 5-chamber view. You can see the aortic valve right there. Okay, let's open it up, and then you have one pulmonary vein right there, another over that side. So you want to pull it down towards the feet. Remember, these movements are very minuscule movement. These are very fine movements. Okay, so it's nothing drastic, or you know. So this is the 5-chamber view. You just pull down the transducer a little bit, and you will be able to open. Okay, so just as a VSD, we're not looking at that because you're not ready for that as yet. So from the 4-chamber view, you can get the 5-chamber view, you can get the 2-chamber view. Okay, so to get the 2-chamber view, you rotate the transducer or the probe counterclockwise just a little bit. You rotate it counterclockwise just a little bit, and then you get your 2-chamber view. Okay. She was just looking at the VSD, but we're not going there. So this is your 2-chamber view, okay? You're going to rotate the transducer counterclockwise, and this is going to be your inferior wall right there. This is the anterior wall, the mitral valve inside. This is your left atrium, okay? Your 2-chamber view. Apical 2-chamber view. To get your apical 3-chamber view, all you do is just rotate it the same counterclockwise, just a little bit more. Just a little bit more. Again, these are very fine movements. So if you do anything drastic, you're going to lose your picture. So this is the 3-chamber. Well, let me just see. This is a Stilla 2. Again, I say just rotate it a little bit more counterclockwise, and you get your 3-chamber view. So this is your 3-chamber view, and this is your inferior lateral wall. Anterior septum is right there. Mitral valve is right inside here. This is the aortic valve right there and the ascending aorta. That's why we call it a 3-chamber view. Okay, mitral valve is right inside there. Aortic valve here. This is the ascending aorta, left atrium. 3-chamber view. Just counterclockwise a little bit more. Okay. All right. So when you finish with your 3-chamber view, then you can move to your subcostal. Right, then you put color in, looking for normal flow. So you see your subcostal, the liver is right there. The right side of the heart is right against the liver. This is your ventricular septum. So this is your left ventricle. This is your atrial septum, the right atrium, left atrium. The mitral valve is right there. The tricuspid valve is right there, tricuspid valve, and your mitral valve is right there. Okay, subcostal view, and then if you have to look at the IVC, how it drains into the left atrium. So you have to do the necessary rotation to get that. So that's your subcostal. So your probe, of course, goes in the subxiphoid area. So this is your inferior vena cava draining into the right atrium, and this is the hepatic. This is your hepatic vein. The hepatic vein drains into the inferior vena cava. Okay, so you can see this is your hepatic vein draining into the inferior vena cava, which drains into the right atrium. Again, you can see your inferior vena cava draining into the right atrium. Okay. So, and of course, you have to measure the inferior vena cava at end expiration. Okay, you have to see the width of it. So that's your standard views. The only thing we didn't do is this suprasternal notch view. But again, you need to practice. You need to go over it because